Hi, thanks for joining and watching this little video by Clark & Associates. My name is Travis. With me is our resident Alex. The first and most simplest device we're going to talk about today is called the LSO, or the Aspen Lso. It's typically when we're looking at involvement between L1 and S1. Most commonly used for lower lumbar stability and support post-surgically. Every once in a while for a low compression fracture at L4 or L5. As you can see, it's one piece, it's universally sized. Mark and I, or Alex, will have the device adjusted to the appropriate circumference prior to you ever needing to fit them. But at the very end of this, we'll show you how to adjust in case there's somebody's retaining water or bloated or distended and there's a need to adjust the size while they're at their hospital stay. The fitting of all these devices is going to be done in the supine position. We never want to fit any type of device that we're trying to unload and stabilize the spine under weight-bearing conditions. Most of the spinal precautions are going to be listed into the chart, and please reference or refer to those with each and every patient. Starting in the supine position does a number of things for our benefit. It allows us to make sure the patient is stable and in an elongated position. All of the devices we're going to talk about today, including the Aspen Lso, is designed to keep the spine in an elongated, stable, appropriately aligned position, and the best way to do that is with them lying down. Once lying down, you're going to use standard log roll technique to roll the patient. Just be careful to consider IV lines and drains. You always want to roll away from the drains so we're not catching the drain when we don the orthosis. We're going to, in this instance, roll Betty towards Alex. The LSO's target zone is low. We want to actually grab some of the hip and stay around the navel level when it's applied. So it's simply a matter of tucking the posterior section of the LSO underneath the patient while they're rolled. Once you have the position somewhat where you want it, you'll then roll the patient back down onto their back in supine. You'll check your alignment to make sure you're in the appropriate position on the body, and it's a simple closure with one Velcro tab. The Aspen verbiage, or the Aspen name, should be in the target area of the navel. It's not a bustier. It does not, if it's up here directly underneath the breast, the device is on too high and it's going to be uncomfortable in sitting and it's not going to be effective. So when it's on appropriately, the navel is covered and these bottom extensions actually grab a little bit of the hips. Once the device is on with the big overlapping panel in the front, the next step is to apply some compression utilizing the pull straps. The straps are pulled, which cinches the brace around the waist, and then laid down anteriorly over the device to lock everything in. This will vary depending on how much fluid or how much the patient's eaten, or if they've had a bowel movement after surgery. So this is something that the patient can control. It's very simple. You just want it comfortably snug. Once the device is on, the patient can then be sat or moved, or the mobility aspects of their care can ensue. To remove the device, simply reverse order of operations. Again, you're going to lie the patient down into supine. You're going to loosen the pull straps. That's going to allow the brace to expand and be nice and big and ready and easy to put on the next time. You will undo the panel, ask the patient to roll, and pull the device out from the back. By far the simplest and most tolerable device that we fit on the floor, but it's got a very low effective range, L1 to S1. Thanks.